So, ma'am, we are on live, ma'am, and we are
Okay, sir.
starting.
Yeah, you can start, sir.
So, very good evening, doctors. I am Dr. Stalin on behalf of Shield Healthcare, welcoming you all for today's webinar. So, the topic for today's webinar is recurrent vaginal infections, what to do. So, I welcome all the participants and I request them to post their queries, if any, in the chat box so that we can have a short Q&A session at the end of this presentation. And now it's time to introduce our invited speaker for the day, Dr. Jayanti Prasad, ma'am. Madam has done her MS OG and DNB OG. Madam is currently the Senior Assistant Professor at Madurai Medical College, Madurai. Madam is the UG and PG teacher for the past 11 years. And Madam was also the Joint Secretary in MOGS. Madam has received her gold medalist in MSOG, and Madam has also presented various national and international papers. So with this short introduction, I welcome you, ma'am. I'm handing the session to you for your presentation.
Thank you, sir. So we can start about with the topic. So we have many sides. So today topic of discussion is recurrent vaginal infections, what to do. So because why we have chosen this topic is, we know in our gynec practice, every 4 to 5, 1 in 4th or 5th patient will be a patient who is having a complaint of white discharge or leukorrhea. So how to manage about these patients, what to do? Different age group has different type of pathophysiology. So let's see how we proceed about with the patient who is coming with vaginal infections. So we know that what do you mean by microbiota? Microbiota is the commensal community which is present in one particular organism. That is, it is a microorganism which is normally present in one particular organ. So it may be good or bad. It is usually a combination of both, but usually when the good organisms keep high, they keep the bad organisms under control. So that's what happened with the vagina. The lactobacillus is the common commensal, which is usually higher in number, which protects against a sense infection. When the lactobacillus gets down, there comes all the infections in the vagina. So every organ, like for example, oral, skin, gut, and vagina, they have specific strains, and thereby the microbiota differs. So when coming to the reproductive system, the upper and the lower reproductive system itself has its own commensal. For example, in the upper reproductive system, the lactobacillus is the common organism, but others include bacteroids, proteobacteria, actinobacteria, etc. While coming to the lower, in the childhood, it depends upon the age group. In childhood, E. coli and anaerobes predominant. In the puberty, when the puberty begins, and usually after the menopause, the lactobacillus colonization occurs. And in the post-menopause, the enteric and anaerobic bacteria are the co-dominants. So there are many factors which will modify the vaginal microbiota. So first, as I said, is the age itself. So this depends upon the presence or absence of estrogen. So when in the childhood, when the estrogen is low and glycogen levels are low, the lactobacillus is obviously going to be low, and the vagina has a thin vaginal epithelium, and it has an acidic pH. In adult women, that is from the puberty to menopause, the women will have high estrogen levels and glycogen levels, thereby producing more lactobacillus. It will have a thick vaginal epithelium and low pH. When coming to the post-menopause, once again, when the estrogen falls, the lactobacillus also falls. So these are the age-related changes of the vaginal microbiology. What happens in pregnancy? Pregnancy usually has an acidic pH because it prevents the entry of microorganisms into the uterus. So there is normally low secretions of mycoplasma and ureaplasma. That is decrement in pH. That is a decreased pH, which means the pH is acidic in pregnancy. And there is an increment in vaginal secretion. And others, mainly the infections. Infection will definitely alter the microbiology of the vagina. In aerobic vaginitis, lactobacilli microbiota gets disturbed. pH becomes 6 to 8, that is yellowish discharge, which we will be describing in details. And another is the bacterial vaginosis, which is most common. Here all the pH becomes alkaline, grayish discharge, and what are the organisms we'll see. So other few things which may alter the vaginal microbiology is ethnic group, change in the pH, smoking, and cancer. So we have seen that normally in the newborn up to 6 weeks, usually the pH is acidic. Pre-puberty, the pH is neutral. Puberty, it again becomes acidic. And in the menopause, it becomes neutral. So this altered microbiology definitely causes urogenital problem to the women because constant itching, discharge, especially the working women, it's become very difficult. So what are the things which may affect or cause altered microvaginal flora will lead to vulvovaginal candidiasis, bacterial vaginosis, urinary tract infection, and pelvic inflammatory disease. Young females, usually the vagina is lined by simple cuboidal epithelium. It is colonized by organisms similar to skin commensals and the pH is neutral. Once the estrogen increases, the lactobacillus predominant. The estrogen increases, glycogen increases, lactobacillus increases, and the pH becomes acidic. After menopause, again, when there is a drop in estrogen, drop in lactobacillus, the pH again becomes alkaline. So what is every uterus will have a physiological discharge. So this physiological discharge is normal. Usually it is white, become yellowish on contact with that. So when the child or any women complains of white discharge, when there is no symptoms, for example, no itching, no burning micturition, no irritation in the vagina, you can leave it off because it is a physiological discharge. This will consist of desquamated epithelial cells, mucus, and bacteria, and forms a transit of the vaginal wall. There may be certain cycle where, or certain duration of menstrual cycle where there is an increase in physiological discharge. It may be in the mid-cycle when there is ovulation, during pregnancy, or when you use an occiput, normal physiological secretion itself may get increased. What is the problem that may lead to any infection? So they say when there is once infection occur, the woman comes to you again and again, she is telling that I have recurrent infection. What is this cause? Because not only the source of origin is the vagina itself. Any gastrointestinal infection is, the woman is having gastrointestinal infection, it may reinfect the vagina. Sexually transmitted disease, if the male partner is not getting treated, again the women will be infected in the vagina. Then vaginal relapse theory itself, when the vaginal colonization of normal bacteria, lactobacillus is increased or decreased, there will be definitely infection. So here comes the role of pre and probiotics, which replenishes the vaginal flora and thereby prevents infection. Okay. So as we have seen, there are a number of organisms which colonize the genital tract, which may be bacterial, fungal, viral, or parasitical. So what do you mean by vaginitis? Vaginitis is the most common OPD patient who comes to us in the gynecological OP. It is a spectrum of diseases. Usually the patient presents with itching, burning, irritation, and abnormal discharge. The most common causes of bacterial vaginosis are vulvovaginal candidiasis and trichomoniasis. Among these, the bacterial vaginosis contributes to major component of 40 to 45% of infections. See how is a curdy white discharge the patient will have. It is more common in the premenopausal women. It is mainly because of the normal commensal decrease, lactobacillus decrease, and the patient will present with 50% asymptomatic, but usually they present with an unpleasant, fishy smelling discharge, itching, inflammation, usually are uncommon bacterial vaginosis, more predominant during and following menstruation. They have a creamy white discharge. So this is the famous criteria of Amsel's criteria to diagnose bacterial vaginosis. What does it contain? It contains either homogeneous grayish white discharge, vaginal pH of more than 4.5, whiff test positive. We'll see what is whiff test. Clue cells on a wet mount. So among these, at least 3 criteria should be positive to say it is a case of bacterial vaginosis. Clue cells are the most reliable predictor of bacterial vaginosis. So in a wet mount, if you add, you can see leukocytes, lactobacilli, clue cells, yeast or trichomonas, and whiff test is when you add 10% KH to the vaginal secretion. This secretion will discharge a fishy or amine odor, which is called as whiff test. So for revising, Amsel criteria includes grayish or whitish discharge, vaginal pH of more than 4.5, whiff test, and clue cells on a wet mount. At least 3 criteria should be positive to say it is a case of bacterial vaginosis. So there is another criteria called Hay and Eisen criteria for grades of flora. You say it is a grade 0 vagina if the epithelial cells has no bacteria. If normal vaginal flora is seen, it is grade 1. Reduced number of lactobacillus with increased bacterial flora is grade 2. Grade 3 is mainly bacterial flora only. No or absent lactobacillus. And grade 4 is gram-positive cocci only. There is another criteria called Nugent criteria. It is depending upon the number of anaerobic species. If you see 0 to 3, it is considered as negative for bacterial vaginosis. 4 to 6 anaerobic species is considered intermediate. And when you have 7+ species of anaerobic species, it is considered as a case of bacterial vaginosis. So most common therapy, the patient may resolve with 1 or 2 days, it may resolve spontaneously. If the patient comes to you with symptoms, you definitely have to treat with metronidazole is the first and foremost drug of choice. 400 milligram twice a day for 5 days is given. Local application metronidazole gel can also be used for 5 to 7 days. Single dose therapy can be good, but high dose single therapy will present severe vomiting and bitter taste. The patient will not be preferred to take. Hence, it is preferred to give 400 milligram twice a day for 5 days. Clindamycin is another choice. 300 milligram twice daily for 7 days can be given. or topical vaginal cream can also be given. Pregnancy and bacterial vaginosis, most common in the first trimester, can lead to second trimester abortions and preterm labor. Metronidazole can be given during pregnancy. Anyway, you avoid single large doses. See, this is a typical picture of showing vulvovaginal candidiasis. Up to 75% of premenopausal women have at least one episode. It is rare before menarche, but 50% will have by the age 25. Candida albicans is one of the other causes, important cause of yeast infections. Yeast is more commonly found in the vagina, mouth, and in the skin. It is an opportunistic pathogen. See, Candida albicans usually grows in an acidic pH. Hence, it is more common in pregnancy because in pregnancy, the pH will be acidic. All other bacterial vaginosis, everything, the pH becomes alkaline. But for Candida albicans, it is acidic pH. Factors predisposing to vaginal candidiasis: immunosuppression, HIV, other immunosuppressive drugs, diabetes mellitus, regular vaginal douching, increased estrogen, pregnancy, high dose ocipil, dermatosis, and broad spectrum antibiotic therapy. So other Candida species can also lead to infections. So what will be the type of vulvovaginitis here? The patient will present with pruritus, burning sensation during externally, irritation, soreness, white clumpy discharge, the normal vaginal pH, or it may be acidic, and vulvar edema will be present. So you put a wet mount, you can see the yeast cells or yeast buds or hyphae. On a KOH preparation also, it can be easily demonstrated. So treatment, always you go for uncomplicated therapy. You go for any imidazoles, that is antifungal treatment. Fluconazole single dose 150 milligram, or itraconazole is now usually the drug of choice, 200 milligram twice a day for 1 day. It is contraindicated in pregnancy. Local application of clotrimazole cream can also be used. So topical treatment can be extended up to 2 weeks if there is severe and recurrent doses. Here you can take the induction regime is given, fluconazole given in 3 doses orally over 72 hours, and maintenance therapy of 150 milligram weekly for 6 months. In pregnancy, you can use usually local application of tinidazole for 2 weeks. So what is another cause of vaginal infection is Trichomonas vaginalis. You can see the floating protozoa here. The cervix becomes strawberry. So it is called a strawberry cervix. There is purulent, malodorous, frothy discharge for the patient, and dysuria, dyspareunia are common. Trichomonas is seen in 50 to 70% of patients with elevated pH, can cause leukocytosis. Treatment: metronidazole 2 grams single dose or 500 milligram BD for 7 days. Usually you have to treat the partner also, otherwise the patient will be having recurrent infection. Usually topical therapy is avoided, and both partners should be treated. Gonorrhea caused by Neisseria gonorrhoeae. It's a gram-negative intracellular diptococcus. It causes mucus-secreting epithelial cells. Here, multiple sexual partners is most commonly affected by this. Adolescent females may be having, usually it is more common in low socioeconomic people. So it is transmitted via mostly the sexual transmission. So it is asymptomatic. The patient will have only cervicitis or urethritis. Clinical feature may be abnormal vaginal discharge, intermenstrual bleeding, dysuria, pareunia, etc. And incubation period may be up to 10 times. So you can use NAT techniques or hybridization techniques, culture techniques. You can take a vaginal swab culture and diagnose gonorrhea. So here in uncomplicated cases, you can just treat with the cefixime oral or ceftriaxone injection single dose, ciprofloxacin, ofloxacin once, or levofloxacin once. Pregnancy should not be treated with quinolones or tetracyclines. Treat with alternate cephalosporin. Cephalosporin does not tolerate it. You can go for spectronamycin 2 grams IM. Okay. Syphilis may occur in chronic cases without treatment. Transmission is usually sexual rate. So what are the factors which affect the vaginal infection of the women? You have to treat that. Only treating the infection alone will not give a permanent solution. Poor personal hygiene, obesity, using too much soap in the vaginal region, uncontrolled diabetes, wearing too tight clothes, use of feminine deodorants, douches, scented sanitary products, excessive use of antibiotics and hormonal contraceptive, change in sexual partners, unprotected sex with a person with STD, pregnancy, recent childbirth, and menopause. So any correctable reasons should be corrected so that the patient will prevent having recurrent vaginal infections. So now let's see what is the role of probiotics and prebiotics in vaginal candidiasis or any vaginal vaginitis. So usually we have to maintain the vaginal homeostasis by, that is, the level of good and bad bacteria should be equal. If the good bacteria predominant, it's good. If the bad bacteria predominant, there is a problem in the vaginal flora. So probiotics containing lactobacillus is used over a long period of time and alternative to antibiotics, particularly within the context of high infection recurrence rate. This possibility of harnessing specific bacterial strains and not to prime microbiota. So what is the role of probiotics? Probiotics, it is better to antibiotic. It replenishes the flora. So that is the main purpose of probiotics. So WHO itself has used probiotics. What are prebiotics? Prebiotics are compounds in food that induce the growth or activity of beneficial microorganisms. So when you add a probiotic with a prebiotic, you give symbiotics. So overall, this increases or maintains the pH in the intestine and also in the vagina. It stimulates the local immunity. It stimulates peristalsis, removes excess mucus, and suppresses the reproduction of intestinal pathogenic bacteria. So all this will ultimately give a better cure for vaginal flora. So we have already studied that the vaginal flora is mainly made up of 90% of lactobacillus and 9% of bifidobacterium and 1% of other bacteria. So to maintain vaginal homeostasis, we need lactobacillus. So lactobacillus is produced by lactic acid and maintains a vaginal pH of 3.8 to 4.5. Lactobacillus produce H2O2 and bacteriocins and does not allow attaching bad bacteria to the wall of vagina by competitive inhibition. So this happens whenever there is a fall in lactobacillus, whenever there is a fall in estrogen, fall in glycogen, fall in good bacteria, there is increased reason for vaginosis. So this happens in bacterial vaginosis. An altered bacterial microbiota, reduced lactic acid production, increased vaginal pH of 4.5, and ultimately alters the vaginal epithelium. So vaginal probiotics have a clear hypothesis that they have a protective role of lactobacilli. Application can be topical, reaching high inocular, and easy sampling can be done. So probiotic, definitely it prevents sexually transmitted infections, preterm labor, good quality of life to the woman, and it is directly oral preparation goes from gut to the vagina. And probiotic also helps in having a healthy lifestyle in the woman by restoring the normal flora. So it has been proved by Indian genome specific strains, vagina specific strains, and maximum colony forming units of 10 billion colony forming unit is ideal for treatment for a vaginal probiotic. So now we have few studies which say that the role of vaginal probiotics is very important to maintain the normal vaginal flora. It's a biological control of vaginosis, which was published in 1991 to 97. Another paper which suggests that vaginal microflora for IVF patients, especially if who have a good vaginal microflora, will give good pregnancy results in IVF treatment. It is now widely accepted that native strains will have better efficacy on local population. And the right lactobacilli is usually the lactobacillus, which is cultured vaginal lactobacilli. It is used for identification and is used for also treatment of vaginal bacteriosis. So studies in European Journal of Obstetric Gynecology have suggested that whenever you increase when you treat bacterial vaginosis before IVF, the pregnancy rate doubles. So all these studies have shown that when vaginal microbiota is replenished with lactobacillus, the IVF outcomes and pregnancy rates are definitely going to be increased. Patients who have good lactobacillus in their vagina. Okay. So all these studies have just suggested that IVF and ART success rates depends upon the normal vaginal flora. And the vaginal flora and preterm birth also, those patients who are treated with probiotics definitely has a decreased rate of vaginal infection and preterm labor. So to summarize, vaginal infection remain highly troublesome, emotionally traumatic condition for women and patients in spite of major therapeutic advances globally. Vaginal infection affects the women's quality of life, may impact negatively on her sexual life as well. Etiology of recurrent infection is multifactorial. All women presenting with recurrent vaginitis should have a genital examination to exclude alternative diagnosis, and you have to refer to specialist sexual health services if needed. Thank you.
Thank you, ma'am. Thank you very much for that wonderful presentation, ma'am.
Okay, sir.
Ma'am, let me wait for 1 or 2 minutes for the participants to post their queries, ma'am. If there is any question, I'll read it for you, ma'am.
Okay, sir.
Ma'am, I have one personal question, like how long it takes, ma'am, for example, if you are treating with the probiotic, how long they should take these probiotics?
At least 2 to 3 weeks they have to take, so for the normal microbiota to revert. So, but taking probiotic alone will not solve the solution. Minimum 3 weeks they have to take, but they have to treat the cause also. Like for example, any presence of infection, male partner treatment, all should be done. Our diabetes should be brought under control to have an effective treatment.
Okay, ma'am. Ma'am, is there any specific dose, ma'am?
BD dosage can be given, sir. That's all, sir.
Okay.
It depends how many units of this you are giving. Colony forming units you are giving. Probiotics.
Okay, ma'am. Ma'am, during this fertility treatment, what is the ideal time to give these probiotics, ma'am? As whether we can start prayer or during the fertilization process.
Sir, prior itself, sir, because only when for all our success rate, a vaginal flora should be good. At least I think 1 month to 2 months prior to planning the embryo transfer itself, you can start her on probiotics. Minimum 1 month.
Okay, ma'am.
Okay, sir.
I request the participants, if you have any queries, you can please post, or we can end the webinar for today.
So no more. Only 5 participants are there. We can end this.
No, ma'am. This is only the
Anything they
speaker.
can just contact me, sir.
Yeah, sure, ma'am. Okay, ma'am. If you allow us, then we can end the webinar for today, ma'am. And this is only the speaker link, ma'am. Delegates are in the other link, ma'am. So I can.
Oh, okay.
Yeah, ma'am. So fine, ma'am. If there is any queries, then we will forward to you, ma'am. You can address through your mail or through your.
Yeah, sure, sir. Sure.
Thank you, ma'am. Thank you for being with us today
Thank you, sir.
and for presenting this webinar, ma'am. I will
Thank you, sir.
thank our
I
team.
thank Shield Healthcare for this wonderful opportunity. Slides were also good. I think we'll rightly use the pre and probiotics along with our routine management to improve our pregnancy outcome in ART pregnancies and also in our routine gynecological practice. Thank you.
Thank you, ma'am. Thank you very much.
Thank you, sir.